As the population over 65 grows, more people are exploring physical activities like weightlifting and running to maintain fitness and mobility. Today, we'll look at the physiological changes associated with aging, the impact of resistance training on these changes, and some essential program considerations for this demographic. With increased participation in sports and physical activities, older adults are challenging traditional views on aging and fitness. However, even the most highly trained individuals experience some decline after age 30. Research shows that competitive weightlifting ability, for example, tends to decrease by about 1% to 1.5% per year, accelerating after age 70. For those who do not stay physically active, the decline in strength, endurance, and function can be even more pronounced, increasing the risk of injury and loss of independence. Understanding these changes and their impact is key to designing effective training programs for older adults. Aging brings a gradual reduction in bone density and muscle mass, two critical components for physical function. With age, bones become more porous and fragile due to reduced bone mineral content, a condition that heightens the risk of fractures, particularly in the hips, spine, and wrists. Conditions like osteopenia and osteoporosis make these fractures more likely, especially for women, and are serious concerns for maintaining independence and mobility in later life. Older adults also experience a decline in muscle mass and strength, known as sarcopenia. Imaging studies have shown that after age 30, muscles not only shrink but also accumulate intramuscular fat, decreasing muscle density and tendon compliance. This loss of muscle mass and strength is largely associated with physical inactivity, hormonal changes, and natural denervation of muscle fibers over time. The decline in muscle power happens faster than strength, affecting the ability to perform quick movements like stair climbing, which are essential for everyday activities. These changes contribute significantly to a person's functional limitations and can make activities that were once simple, like getting out of a chair, increasingly challenging. Alongside musculoskeletal changes, older adults experience declines in neuromotor function, which increases the risk of falls. Falls can have severe health and social consequences, often leading to joint dislocations, fractures, and a reduction in confidence in one's mobility. Many falls result in long-term disability, institutionalization, and, in some cases, fatalities. Factors contributing to this increased fall risk include declines in muscle strength, slower reaction times, and impaired balance and postural stability. Older adults often rely on a strategy called co-contraction to maintain balance. This involves activating both agonist and antagonist muscles around the joint, which provides stability but reduces overall joint force output, making movements less efficient. Programs for seniors should incorporate training methods like low-intensity plyometrics, balance and dynamic stabilization exercises, and proprioception training. These modes specifically target neuromotor control and balance, helping older adults to respond more effectively to changes in their environment and reducing their fall risk. Fortunately, the aging process does not inherently diminish the body's ability to adapt to resistance training. In fact, older adults who engage in resistance training can achieve notable gains in strength, power, muscle mass, and bone mineral density, which contribute to functional capabilities like gait speed. These improvements help reduce injury risk, support independent living, and enhance overall quality of life. One study found that even sedentary older men who began resistance training more than doubled their knee extensor strength after a 12-week program. Similarly, improvements in muscle strength and functional tasks like stair climbing, balance, and walking speed have been documented among both men and women who participate in resistance training. Power-focused training programs are also particularly effective, with evidence suggesting that high-velocity power training can improve explosive strength and functional abilities more effectively than slower traditional resistance training approaches. When designing programs for older adults, it's important to take age-related considerations into account, such as pre-existing health conditions, previous training experience, and nutritional status, as these factors may impact their ability to engage in physical activity. Older adults may need medical clearance before starting an exercise program, particularly those with heart disease, arthritis, osteoporosis, or diabetes. In the initial stages of training, it's beneficial to start with lower intensities and volumes, focusing on correct technique to prevent soreness and injury. Resistance machines can be useful for beginners with balance limitations, but free weights and multi-joint exercises should be introduced as participants progress. Older adults should avoid the Valsalva maneuver, holding their breath during exertion, as this can lead to sudden increases in blood pressure, posing a risk for those with cardiovascular conditions. Recovery is another essential consideration, as older adults often need more time to recover between training sessions. For this reason, a training frequency of twice per week is recommended, with at least 48 to 72 hours between sessions. Gradual progression is key, moving from lower to higher intensities as participants gain strength, with an emphasis on training exercises that mimic everyday activities like carrying and climbing. Proper nutrition is also vital to supporting the adaptations to resistance training. Sufficient protein intake, in particular, is essential for muscle maintenance and growth in older adults, as inadequate levels of macronutrients and micronutrients can negatively impact health, recovery, and adaptation. Improving overall dietary quality and ensuring balanced nutrient intake can maximize the benefits of resistance training and improve general health outcomes for older adults. Traditionally, aerobic exercise has been promoted as the main fitness activity for older adults. However, with age-related losses in muscle strength, power, and mass affecting most seniors, resistance training has become an essential component of fitness. Not only does resistance training help to counter these declines, but it also supports an active and high-quality lifestyle. The core principles of designing a resistance program are similar for both young and older adults. However, when working with seniors, strength and conditioning professionals need to consider certain critical factors. Before starting a program, it's important to address any medical conditions, past training history, and nutritional status, as these elements can influence safety and effectiveness. Prior to engaging in any exercise program, older adults should complete a thorough health screening and risk factor assessment. This typically includes a medical history and, in some cases, a doctor's clearance for more intense activity. This step is especially important for individuals with existing health conditions such as heart disease, hypertension, arthritis, or diabetes, where safety and precautionary measures are vital. In many cases, baseline measurements of strength and cardiovascular response are beneficial. While a treadmill test is often used to gauge cardiovascular health, strength assessment is ideal to help design a tailored resistance training plan. In the early stages, machines might be used for exercises, particularly if balance or flexibility is a concern, but gradually incorporating free weights and multi-joint exercises can create a greater overall training stimulus and increase postural stability. It's also important to address specific concerns that may arise with older adults in resistance training. For instance, the Valsalva maneuver or holding one's breath during exertion is generally discouraged as it can cause a sudden rise in blood pressure. This is especially risky for seniors with a history of cardiovascular disease. Older adults should be encouraged to breathe continuously during exercises to prevent this blood pressure spike. Studies support the safety of resistance training for seniors when following appropriate guidelines. However, poorly designed programs can increase the risk of injury. Common risks include insufficient rest periods between exercises, introducing overly technical movements too soon, and raising the intensity too quickly. A gradual personalized approach ensures that progress isn't made at the expense of safety. Like when starting a program, older adults who are new to resistance training should begin with lower intensities and volumes, focusing on learning proper technique before increasing resistance. This approach minimizes muscle soreness and reduces the risk of injury, which is particularly important for those who may be apprehensive about training. After this initial period, progression should be gradual, aligned with each individual's needs and health status. Once basic exercises are mastered, more advanced movements can be introduced, including standing postures with free weights, medicine ball exercises, and balance training such as one-legged stance. Programs should ideally evolve from low-intensity exercises, around 40% to 50% of a one repetition maximum, to moderately higher volumes and intensities up to 60% to 80% of a one repetition maximum, depending on each individual's goals and fitness levels. For older adults with sufficient experience, high-velocity, power-focused exercises can also be introduced to enhance explosive strength and functional abilities, as power is a key factor in preventing falls and maintaining mobility. Research recommends beginning with lighter loads for high-velocity exercises, around 40% to 60% of a one repetition maximum, and focusing on quick, controlled movements for 6 to 10 repetitions. To support ongoing progress and prevent overtraining, a well-designed program should include variations in volume and intensity throughout the year. This concept, known as periodization, is critical in senior programming, as older adults often require longer recovery times. Typically, resistance sessions twice per week are ideal in the early stages, providing ample recovery time between workouts. Strength and conditioning professionals should also remain attentive to each participant's goals and health history, as these factors may require ongoing adjustments to the program. Building confidence and offering consistent support can greatly improve adherence among older adults, which is crucial for achieving long-term benefits. Another essential consideration for older adults engaging in resistance training is nutrition. Adequate protein intake is particularly important as it supports muscle maintenance and hypertrophy, allowing older adults to gain strength and muscle mass. Nutritional deficiencies, whether in macronutrients like protein, fats, and carbohydrates, or micronutrients, vitamins, and minerals, can negatively impact recovery, immune function, and training adaptations. In summary, resistance training offers significant benefits for older adults, from increasing muscle mass and strength to supporting bone health and balance. With the right approach, starting with a health assessment, implementing gradual progressions, and ensuring sufficient recovery, older adults can safely engage in resistance training and enjoy improvements in physical function and overall quality of life.